Professor Montagnier, could you explain your view on what the role of HIV is in AIDS?
I would say first, without HIV there won't be any AIDS epidemic. HIV is the transmissible agent of AIDS, and it's a necessary factor. Of course, what we don't know exactly is how HIV brings about the whole aspects of the disease. And we don't know, if, for instance, how the decline of CD4 lymphocytes is obtained. Of course, we know that HIV can infect some of those lymphocytes and kill them. But this number is rather small, especially between the primary phase, the primary infection, and the end of the disease. There is a very long silent period of 7, 8, 9 years or more, in which we don't see much of the virus. So what's going on during that time is really a problem. And recently we found that many lymphocytes, mostly CD4, but also some CD8 lymphocytes, other kind, are dying by a process known as apoptosis. They are dying when we put them in culture, and they are dying more by apoptosis if we activate them by antigen, or what we call super antigen, some bacterial antigens. So this means more lymphocytes are dying than lymphocytes are actually infected with the virus. So we have to explain this, and there are some explanations, for instance, starting from the fact that the HIV code protein, the GP120, can bind to the CD4 and send a signal which will prime the cell for apoptosis later when they are activated by an antigen or a super antigen. Probably there are some other ways to kill the cells, and this is not really known.
Can we cut there? That's fine. Can we just cut? Yeah. And then remember from then on not to just throw lymphocyte CD4 in. Unfortunately, it's the immune cells or the white cells that do this.
Okay.
Yeah. Okay. Could you explain your view on the role of HIV and AIDS?
Certainly. I think without HIV there won't be any AIDS epidemic. AIDS is transmissible, it's a transmissible disease, and is transmitted by a virus called HIV. Now, there are still some problems. For instance, HIV infects some cells of the immune system in the blood, in lymph nodes, but not many at the beginning. Despite of that...
Oh, what bad luck. Cut! On we go. Could you explain your view of the role of HIV in AIDS?
Yes, very simply I would say that without HIV there won't be any AIDS epidemic right now. AIDS is a transmissible agent of AIDS. Sorry.
Never mind.
HIV. Okay, we start again.
Yeah.
Okay.
Could you describe your view of the role of HIV in AIDS?
Certainly, I would say rather simply that without HIV there won't be any AIDS epidemic right now. HIV is the transmissible agent of the disease. I don't think there is a doubt for that. But there are still some problems to explain how HIV brings about AIDS. For instance, there is a very sharp decline of some immune cells, of cells from the blood, from the lymph nodes, which are very important to keep in a good shape our defense. And those cells are attacked by the virus, but not many, just a few at the beginning. And so we have to explain why so many cells, so immune cells, die during the disease. And this is probably due to some indirect process, like a process of programmed cell death we call apoptosis, in which the cells receive some signals, perhaps coming from some HIV proteins, and they are primed to die later when they are activated by antigens, or what we call super antigens. So it's quite a complex process, but we are starting to unreveal that and to understand what is going on.
How have you changed your views on HIV since the early days? How have you changed your views on HIV since the early days?
Not much in terms of HIV itself, because we say already in 1983 that HIV was the best candidate to be the cause of AIDS. And we already also mentioned at that time that probably perhaps HIV was helped by some factors like other infections. We still are keeping that view, but it's probably more complex than this work at the time. And we see some autoimmune response, for instance. The immune system is destroying itself at the end of the disease, which would also help explaining why so many cells are dying. But also what we call the cofactors was not clear at that time, but seems to be clearer now, although there's still much work to do. For instance, we think mycoplasma, as well as some viruses and some other bacteria, are perhaps important in activating in our own way the immune system, and those cells activated will die when they meet HIV.
But there was a time when many scientists believed that HIV alone could cause AIDS. Is this a view that you ever held?
Well, I'm still balancing, you know. It's really sometimes a matter of semantic. Of course, if there was no HIV, there won't be any AIDS epidemic. You might see a few patients which could have also their immune system highly depressed without HIV. That is possible. But those are very rare, and this is not a transmissible disease. So without HIV, there won't be AIDS epidemic. But the problem is to explain why HIV is probably a long-known virus, probably a virus already existing in the human species for some time, why the epidemic started about at the time of 1960, 1970. And this is not clear. So I'm still pursuing the idea that some biological factors have increased the virulence of the virus. Not only mutations, but perhaps some other infectious agents. I strongly believe some mycoplasma species are involved in that.
What is your view of a toxic effect, say, of recreational drugs combined with IV drug use causing the epidemic when it appeared?
No, I believe the IV use, and not only the IV drug abuse, but also cocaine, for instance, any kind of recreational drugs, will decrease the defense of the immune system, the strength of the immune system. And this will allow HIV to infect at much higher rate. So this will explain why, at the beginning, many IV drug abusers, also homosexual, because homosexuals have also some kind of immune depression, also hemophiliacs, were mostly infected in the developed countries. But we know now that, for instance, in Africa, this is not the case. And we know also some cases of transfusion, of AIDS obtained by transfusion, after one single blood transfusion, in which there is no other risk factor, no immune depression before. So it means that HIV and some factors included in the blood are sufficient to bring about AIDS, even the immune system is not depressed before.
But could it not be that once your immune system is depleted, HIV just behaves like any other pathogen causing infection, and that it's no different from other bacteria? Why must it be necessary? Because
we find it at the beginning. Many opportunistic agents are only expanding at the end. This is also the case of HIV, at the end of the disease, when the immune system is highly depleted. But at the beginning, there is very little depletion in the homosexual of the IV drug abuser, so no depletion at all in people which have received a blood transfusion. So HIV here is the only risk factor which starts from the beginning. And of course, there is a long period of silent infection, which we have to explain. But the virus is still there. We can find it at every stage of the disease.
Do you think there's a possibility that HIV may play no part in AIDS?
No, I think this is quite against the many data we have. I could list, for instance, the serological data. Almost all AIDS patients have antibody against HIV, some HIV proteins, and we can detect the virus by several molecular techniques, for instance. So there is no doubt HIV is there. Of course, sometimes HIV, the number of cells infected is really small, but HIV is still acting.
Do you think every HIV positive person will get AIDS?
Probably not. If we follow the curves, we see that after 10 years after an HIV infection, about half of the people are getting AIDS, 50% or a little more. If we extrapolate that curve, it doesn't go up to 100%, probably 90%. And many clinicians and ourselves, we are seeing people which have been infected for 9, 10 years or more, 10, 12 years, and they are still in good shape. Their immune system is still good, and it is unlikely those people will come down with AIDS data. So I would say perhaps 90% of the HIV-infected person will get AIDS sometime, perhaps 10 years, 15 years, but 10% probably will never get AIDS.
Is it possible to have AIDS, therefore, without HIV?
Yes, there are some rare cases of strong immune depression, very small number of lymphocytes we call T4, like in HIV-induced, AIDS induced by HIV. But those people, we cannot find any trace of HIV by any technique. So we have to explain how they got that process. Of course, in this case, this is not transmissible. Those people cannot transmit by their blood, for instance, the immune depression. But there's some of them at the same time of opportunistic infection that HIV-infected AIDS patients have. So we have to explain this. And we recently found perhaps some clues. For instance, the autoimmune component we see in AIDS patients is also present in those people. So it's quite possible that some other agents, sometime, also induce some kind of autoimmune reaction which will destroy the immune system. HIV is not the only one.
So what sort of cofactors do you think HIV might need?
HIV might need amplification factors. So for this virus to grow, for instance, the immune depression before HIV infection is important. So this we're explaining why people with dysnutrition, people with which are IV drug abusers, for instance, or any kind of recreational drug users, homosexuals, are more prone to get HIV infection and later on AIDS. Shall we start again?
Yeah.
Okay.
Sorry, I was putting you off, and it was too good to miss. So where were we?
We'll try again.
What cofactors?
In a shorter way. You said.
Yeah. What cofactors? Because you used to talk of mycoplasmas. Can we cut? I think we should.
No, to get autoimmune reaction, we need infectious factors first. I don't believe autoimmune disease happens just like this.
No, exactly.
They need some factors.
Okay. What sort of cofactors do you believe HIV needs?
HIV first need for the infection an immune system which is already somewhat depressed. Okay, and this is the case, for instance, of people which are using drugs or drinking alcohol or are stressed or have some kind of bad feeding or poor feeding. But of course, this is just to increase the risk of infection. Without those factors, you could still have some infection if the dose of the virus is high enough. For instance, by a blood transfusion. One single blood transfusion can bring enough virus to infect anyone in the world. Now, after that, there are some factors to amplify the replication, the multiplication, and the effect of the virus. And here there are two possible variants. One is to say there are many factors, many kinds of infections, virus infection, CMV, hepatitis B, bacterial infection, mycobacterial infection, for instance, can be important, and so on and so on. This will activate the immune system in a wrong way, and when the cells also meet some HIV protein, they will die. But the other variant, which as I favor myself, is that among those factors which are important, there is one factor which is still more important. And I think mycoplasma are the right candidate. Some mycoplasma species are the right candidate to do that because they help the virus to replicate, they amplify the effect of the virus on the T4 cells, and so the cells die more quickly. So they have all the properties to be a good candidate. The problem is to demonstrate they are always present. The same species for mycoplasma is always present. I think there is not one single species, probably several species of mycoplasma can induce the same phenomenon.
What is a mycoplasma?
Mycoplasma, it's a very strange bacterium. It's a bacterium without rigid wall, and it lives on the surface of our mucosas, on the surface of the cells, and pumping out some metabolites which are really necessary for them to live. So they are parasites like virus. But what we found recently, and other groups as well, is that some mycoplasma get also inside the cells. They penetrate inside the cell, living in the cytoplasm like viruses. So they are in the borderline between bacteria, normal bacteria, and viruses. And we don't know much about their life cycle. I think this is really a fascinating world, and we're trying to explore it.
What is your opinion of antiviral therapies like AZT?
I think this is a rational therapy because AIDS being caused by a virus called a retrovirus, which has a specific enzyme called reverse transcriptase. It's important to try to inhibit the action of this reverse transcriptase, which is important in the first step of the infection by the virus. So if we block this, we will block the infection. And AZT so far has proven to be the best drug to inhibit. There are some others now which are also in trial, but AZT was the first. So what I will do, or I will recommend is to the patient, is to stay on AZT treatment because there is nothing better now. And there are very, very careful studies recently published which indicates that the survival of its patient is longer and better under AZT treatment. Of course, there are some toxic effects, but those toxic effects vary from one individual to another. And they are lower now because we use lower dose. We use better dosage of AZT than 2 or 3 years ago.
How would you like to see money spent in the immediate future in terms of research into AIDS?
Well, money has to be continuously spent, of course, on the study of the virus, on the search for better drugs to inhibit the virus, also on vaccines. But we should not also forget about the other factors. This is my view. We should also spend some time and some effort, not only at the academic level, but also the pharmaceutical company have a great importance in that, to search for better antibiotics against the opportunistic agents and also mycoplasma. Because mycoplasma are sensitive to some antibiotics in the lab, in the test tube, but in vivo is quite different. And we know that immunocompromised people are always infected with mycoplasma. We cannot eradicate mycoplasma infection just by antibiotic treatment. So we have to also to look for perhaps some other kind of approach for the mycoplasma factors, perhaps immune therapy, vaccines as well, as for HIV.
Do you think AIDS is a sexually transmitted disease?
I think there is no doubt. The epidemiological data indicate, and I could see some people who come to see me and they have been infected by their wife, or on the contrary, the women have been infected by their husband. I think there is no doubt. AIDS is sexually transmitted and heterosexually transmitted, not only homosexually transmitted, no doubt.
But there hasn't been a heterosexual epidemic.
Well, if you look at the tropical country, I think there has been an heterosexual epidemic. You have as many women as men infected in Africa, in India, in Thailand, and in a very short time, in a few years. Prostitutes, for instance, are infected to a very high rate in Tanzania, in East Africa, in some big cities in India, in Thailand. So there is no doubt. HIV infection is there, and AIDS will come later.
Do you think HIV can be easily transmitted through sexual intercourse?
No, that's the problem, perhaps, which makes AIDS different from syphilis, for instance, or gonorrhea. Because not every sexual contact with transmit the virus and the disease. This is because the amount of virus is rather small in the blood, at least in the asymptomatic phase. Of course, if patients are having full-blown AIDS, they are much more infectious. But at that time, they don't have many sexual contacts. So we are talking about people which are HIV infected, but asymptomatic, no sign of disease. And those people still have a good immune system. So the amount of virus is rather small in their sperm, in their vaginal secretions. So the transmission is difficult. Also, there is some kind of local immunity, which is local defense. which could block the virus infection. So some people could be exposed by sexual contact, but the virus will never go through and infect all the body, you know. So this would explain why the sexual transmission is difficult. But there are some factors which help very much the sexual transmission. There are other sexually transmitted diseases. And this probably is one of the factors which explain why the women in Africa and other parts of the tropical area, which have had more type of genital infection, genital ulcer, vaginal infection, cervicitis, those women are more prone to get infected even by one sexual contact.
You've yourself have admitted that very little virus is found in people with AIDS, even when they're very, very ill.
No, that's not true. In the case at late phase, many cells are infected. Perhaps 1 in 100 lymphocytes, blood cells, white blood cells are infected. So this is a lot.
Antibody or actually pro-virus?
No, virus. I would say viral particles. They are producing viral particles.
I thought no more than 1 in 8,000 lymphocytes.
No,
leukocytes had been
found. This is before the end of the disease, when the immune system is not totally depressed. But at the end, it's like the other agents, you know, mycobacteria replicates, HIV replicates as well. There is nothing to counteract it. Nothing to stop it.
But just because you find HIV, and as you admitted, for long periods of time, very little, just because you find it, does it necessarily mean it causes AIDS?
This is an old problem. We were the first to face that problem in 1983. And of course, some people could say, you have not shown all what we call the court postulate. For instance, you have not been able to reproduce the disease in animals. It's true that chimpanzee, chimpanzee is the only animal which can be infected with HIV-1, the main virus responsible for the epidemic. It's true that those chimpanzees can be infected and do not show disease even after 9 years after inoculation of the virus. But we have another model, another animal model, SIV. This is a virus similar to HIV, very similar by the genes, by the way of action. And this virus can induce an AIDS-like syndrome, and there's no doubt this is really AIDS, same type of disease, in macaques, in some monkeys. And some people have used clone virus obtained from one single molecule of DNA. So no other factors, unless the factors present in the animal. And this virus could cause disease, could cause AIDS-like disease. So I think in that case the core postulate was fulfilled completely.
If HIV can be passed from a mother to a child, and the child doesn't die, couldn't it just be a benign passenger virus?
No, in the case of the transmission from mother to child, the rate of infection is 1 in 5 in our country. So 1 in 5 children is HIV infected, permanently HIV infected, and those children will get AIDS.
But have they?
Half of them in the first year of life, very quickly, because their immune system is not strong enough to contain the virus. And the other half will get AIDS, but like adults, after 5-10 years. But very rarely, perhaps some children could escape, and it would be interesting, like in adults, perhaps 1 in 10 will escape, like in the adults, and will not have AIDS even after 10 or 15 years. So I don't think this is really different from the situation in adults.
Could it be, what is your view, in fact, of the hypothesis that AIDS results from a toxic assault, from high-risk behavior, and that the infections that occur later on are simply as a result of the immune breakdown of the system? So it's a secondary process. What is your view of that hypothesis? I
think it's against what we know about the transmission. AIDS is a transmissible disease. If it was just a toxic syndrome, it wouldn't be transmitted from one individual to another. It wouldn't be sexually transmitted. It wouldn't be transmitted from mother to child. It wouldn't be transmitted by blood. So I don't think this can fit the data we have. And for instance, we do now the blood screening since 1985, and there are very few cases now of AIDS obtained by blood transfusion because of that screening. It means we have removed the infectious agent, the transmissible agent.
Thank you very much indeed. Thank you very much. That was... So what was that 10% question?
Yeah.
I'm quite surprised at that. I think your estimate is low, but still. Let's go.
My estimate is low compared to what? 10%?
Compared to the fact that in America, say, there's 1 million HIV positive people, but only 1.5 million have got AIDS. I mean, sorry.
No.
1.5%. Anyway, we'll talk about figures later.
Well, if you calculate, you have 10 years average between HIV infection, and every year you don't have a much percentage of AIDS, but if you have to accumulate percentage following the infection.
Why is it that 10% of people who are HIV infected will not progress to AIDS, according to you?
Well, we would like very much to know. This is a very important problem, and what we can say, there are probably some stronger immune defense. For instance, what we call cell-mediated immunity is much stronger. Perhaps the virus strain also was milder, and also the cofactors maybe are more controlled than in other people. But those are just hypotheses, and we would like very much to know what is the right one.
If you can have AIDS without HIV, how can you say HIV causes AIDS?
Well, there are always exceptions in nature, HIV can cause AIDS in 99.9% of the cases, but you have also some AIDS-like syndrome, not exactly AIDS, but AIDS-like syndrome with a very low number of what we call T lymphocytes. Without HIV, there are indubitably some cases like this. And in those cases, we found the autoimmune component be present. So it means the autoimmune component was probably induced by some other infectious agent we don't know.
Would it surprise you if in the future it were to be discovered that HIV was a passenger virus and not the cause of AIDS?
This is a question I've been asking myself from the beginning, and I would be very surprised now if really HIV is just a passenger virus, because this was the first criticism we got. But in order to avoid that criticism, our first viral isolate was made not from an AIDS patient, but from a pre-AIDS patient. An homosexual man who was perfectly well. He had just lymph nodes on his neck. And he died only 8-9 years later of AIDS. And at that stage, there was no real immune depression. And because we found the virus. So the virus was the only factor we could isolate at that time. Amperas mycoplasma.
Thank you very much. Do you a question so that you can use your hands as you were, because you were using them a lot like that. Okay? Sorry. So, got up this morning, and how you're feeling?
I'm feeling very well.
Keep chatting, come on.
Yes, well, but ask me something else. It's not very...
Oh, all right. Let me think.
Very interesting. I don't know.
I'd be very interested to have you and Dr. Shai-Ching Lo have a meeting. Actually, also something Dr. Fischel said was very similar to what you said in terms
Dr. Fischel? Margaret Fischel?
In terms of the mysterious quality of these 8 years when nothing happens. Do you know her?
Yes, I know her. Actually, I was invited by her to give a seminar in Miami.
And?
And we have lot of discussion. She, of course, is following many SAT, DDI, DDC trials. She's a clinician, actually. She's not... she's partly a clinician, partly a scientist. She's very good.
Wonderful.